There is a health crisis among school-age children in America, with a staggering 20% obesity rate in children 6 to 11 years of age and a minutely smaller rate of 18% for children aged 12 to 19. It stands to reason a top priority amongst educators, administrators, and parents needs to be solving the problem of childhood obesity. It has been estimated that by the year 2015, 41% of adults will be considered obese. Reducing the incidence of childhood obesity within the school lunch and exercise programs can be achieved by eliminating unhealthy a la carte items from the lunch menu, such as candy, soda, and ice cream, and by replacing them with locally grown fresh fruits and vegetables, low-fat yogurts, and high-fiber snacks. By removing all vending machines or stocking the vending machines with healthy food items only, promoting an increase in activity throughout the course of the school day, and replacing high-fat beef and cheese surpluses with lean meats, low-fat cheese, and 1% milk. This presentation researched and created by Heidi Blazak, Eddie Duff, Jennifer Kingsley, and Mark Rivas. The 10 essential public health services describe the public health activities that all communities should undertake and serve as the framework for the NPHPS instruments. Public health systems should monitor health status to identify and solve community health problems, diagnose and investigate health problems and health hazards in the community, inform, educate, and empower people about health issues, mobilize community partnerships and action to identify and solve health problems, develop policies and plans that support individual and community health efforts, enforce laws and regulations that protect health and ensure safety, link people to needed personal health services and assure the provision of health care when otherwise unavailable, assure competent public and personal health care workforce, evaluate effectiveness, accessibility, and quality of personal and population-based health services, and research for new insights and innovative solutions to health problems. Assessment. Monitor health status to identify and solve community health problems, and diagnose and investigate health problems and health hazards in the community. Obesity rates for children significantly showed an increase amongst children and adolescents between 1974 and 2004. New York has seen obesity rates between the ages of 2 to 19 tripled or quadrupled in a 30-year span. 2 out of every 5 New York elementary school children are overweight or obese, leading to ominous health consequences such as type 2 diabetes and hypertension. New York has continued to see obesity affect their school-age children. More than 1/3, or 33.8% of students, were either obese or overweight from 2008 through 2012. This can be attributed to poor diet and the lack of physical activity. Obesity is not a discriminatory disease and affects everyone regardless of socioeconomic status. Although communities comprised of minorities, lower income, and the less educated tend to be more affected than the middle or higher income populations. The cause is the lack of resources. For example, lower income families' choice of foods are based on income. Foods that are cheaply made, with higher fat content and less nutritious value, are far more accessible than higher quality foods. According to these statistics, males across each race are overweight and obese at a higher percentage than females. Hispanic men and women are within 1 percentage point of each other, representing the smallest margin between the genders. Obesity that has a foundation in childhood ultimately leads to obesity in adulthood. There is a proven link between obesity and adverse health effects. A combination of poor nutrition and a lack of physical activity can and will lead to serious health consequences, including delayed bone development, asthma and sleep apnea, headaches and increased stroke risk, musculoskeletal problems, type 2 diabetes, and hypertension and coronary artery disease. Obesity in the preteen or tween years can lead to heart disease development by the age of 15. With standardized testing being the primary focus of educators, it is puzzling why the connection between poor nutrition and poor test scores has not been addressed. Young bodies and minds require a healthy, nutritious diet in order to grow and function properly. Childhood and adult obesity cause substantial financial ramifications for the state of New York. The New York Medicaid program spends approximately $4.3 billion a year on obesity-related needs. These costs include management of diseases associated with obesity, such as type 2 diabetes, hypertension, asthma, and coronary artery disease. In addition, commercial health insurance carriers and Medicare spend approximately $7.5 billion per year. While the majority of the expenditures are for adults, overweight and obesity-related costs for New York's children stand at a staggering $327 million. Childhood obesity rates among children in New York State are among some of the highest reported. Statistics show childhood obesity is linked to increased mortality and morbidity, especially when obese children grow up to be obese adults. Risk factors associated with childhood obesity include an education or lack thereof has been identified by the CDC as a possible risk factor associated with childhood obesity. As income levels rise, however, so too does the prevalence of obesity. Obesity continues to rise consistently among all income levels and races. The greatest decreases occurred among girls and families with at least a college degree, and the greatest prevalence of obesity occurs in Mexican American children. This graph shows that as income increases, obesity decreases. However, this is not representative of the Mexican American population, as income does not appear to impact prevalence of childhood obesity. Research from a cohort study published in the British Medical Journal identifies 8 factors that indicate the prevalence of adolescent obesity is increased by genetic and early environmental exposures. These relationships are relative and existing among children in the United States, who have also adopted more predominantly sedentary lifestyles and poor dietary behavior. This illustration indicates a lower prevalence of obesity exists among non-Hispanic white and black girls whose head of household has a college degree as opposed to those with less than a high school degree. In response to this issue, New York established a project to address childhood obesity by creating Healthy Places to Live, Work, and Play initiative. This initiative works to improve the health and physical activity status for New York communities by increasing the availability and accessibility of places to be physically active, creating and maintaining community landscapes conducive to physical activity, such as playgrounds and walking trails, increasing the availability and accessibility of fresh fruits and vegetables, increasing the healthful quality of foods offered for sale at local restaurants and corner stores. Since 1980, obesity prevalence among children and adolescents has almost tripled. The United States Department of Agriculture is one federal agency that plays a vital role in monitoring, investigating, and addressing childhood obesity. The USDA utilizes the Economic Research Services that examines differences in dietary patterns by social, demographic, and economic factors, how economic incentives and behavioral factors influence food choices and diet quality, how food choices affect diet quality and health, the association between dietary patterns and obesity, and the intended and unintended consequences of obesity policies.